as a layman, no doubt you don't have medical knowledge, but as a layman, you should know a basic life support technique, CPR. Why? Because in any event, for example, like heart failure, heart attack, you know, in any place that you come across, you can render assistance to help.
Hi, I'm Josh, and today I'm going to learn how to do some CPR.
Hi, my name is Nadia, and we are in MAHSA University College right now, and we are learning first aid today. So with me here, I have Karine, and this is her first time actually trying out doing CPR and learning about first aid. Yeah, so we just asked her some questions. Okay. So Karine, today, what did you learn today?
Okay, so basically we went through about the whole program that MAHSA offers, and also the basics of CPR, what to do, what not to do, the common mistakes and the steps. And we also learned hands-on on the mannequin. So yeah, it was pretty interesting.
No, I got a feeling I'm gonna kill you.
Is it?
No, your hand. Don't cover.
Okay.
Here.
So basically,
Okay.
Rest, let go. Rest, let go. So this is the nipple line, the center here, this part.
What to the middle? Now you take the pulse. Okay, no pulse. There you go.
You're not supposed to be so loud.
Okay.
Bye. You're good. Now, when you try rescue somebody, do not put yourself in danger. Okay? Let's say you found the victim in the middle of the road. Don't do the middle of the road. You need to take him to the side.
hari ini saya dengan Bro Framestone, Ben Ashari. Pendapat anda tentang hari ini, adakah anda belajar sesuatu yang baru, you know, atau you dah tahu dah macam mana?
Yeah.
Okey. Kesimpulan ni mudah saja. Tak belajar, rugi.
Kita make sure keadaan masa dalam keadaan selamat, di mana tak ada apa kata bahaya, mungkin ada masalah apa poison ke udara yang tercemar ke apa, ke open air, and then make sure tepuk mangsa, tengok dia ada respon atau tidak. Kalau tidak, kita check dia punya nadi, dia beat atau tak. Kalau dia beat, kita tolak dagu ke atas dan buka sikit mouth untuk make sure ada aliran udara masuk, and then kita hear tengok ada udara atau tak, pernafasan lah. After that, kita buat what we call this one? Compression. Compresi.
What is the most important strength that MAHSA has to offer to students?
I would say the most important strength is clinical training. I mean, you have to have good clinical training, which gives you a basic, solid foundation. You know, to when you sort of work with patients. I think that is our strength. From years 1 to 5, we have a big emphasis on clinical training, on every practical component.
In terms of health science, what we're dealing with is real patients, human beings, right? So definitely we need more exposure to people, right?
Yes, I completely agree. I think the patient is the primary person of, you know, you have to give him your 100% concentration. And it's a profession whereby you cannot make mistakes. It doesn't matter whether you're a doctor or a dentist or a nurse. So, you know, I'd say that our strength in clinical training will hopefully make for better healthcare professionals among our students.
So thank you so much for your talk.
Thank you very much.
See.
There's 2 labs. It's divided into a wet lab and a dry lab. As its name suggests, a wet lab is where we do dissection, and this is where we look at specimens.
Okay, so Andrew, what's this?
Okay,
Okay, this is our clinical skills lab.
Okay.
Step right in now.
This is really like a hospital look around.
It is built like this, yeah.
Yeah.
It's built like in the way of a clinic, set in a clinic, so that we can get real-time teaching. So when we switch it on, you can actually hear the heart murmurs and the heartbeats, and it will actually sound.
Alright.
So
it's quite fragile because it's still waiting for it to set. Once it's been set, a casing like this is built.
Do they do over here? They dissect people? Or?
yep, there are points where we do get cadavers. So from the first year, we let our students.
Wait, you said cadaver. What is cadaver?
Cadavers are pretty much bodies, dead bodies.
Alright.
And from the first year, we allow our students to start dissecting.
First year itself?
Yeah, from the first year itself.
That is scary.
This is what happens when you have carcinoma on the lungs.
Do not smoke.
So yeah, that's a big thing. This is our computer-based learning, and this is where we have a good student to computer ratio, 3:1, and wherever we do dissections and on slides, this is what we use with computers for learning. And from this is actually what we call Olympus VX41, and once we dissect and we have these slides there, we are able to put the slides in and beam it across to all the other computers. The patient will attach pulleys and levers, and they'll learn how to use their arms again. Yeah. A lot of times they won't know how to use their arms, so your body literally forgets.
Apapun, terima kasih pada MAHSA.
Alright.
Thank you, MAHSA.
Terima kasih.